hurricane's impacts. It may be causing problems for those suffering from allergies and asthma. Reena Mehta with the Uptown Allergy and Asthma joins us today to explain. And, I'll tell you, Dr. Mehta, I have been really suffering with that. Headaches in the morning, sneezing and sniffling a lot. And a lot of it has to do with some of the storm debris and other issues of preparing for your allergies and your asthma. Tell us a little about why we're dealing with this right now.
So that's a great question. So hurricanes and tropical storms do stir up a lot of allergy and asthma issues. Reasons for that being when you have a lot of wind releases pollen, and pollen gets into the air, and then you breathe those things in, and you get a lot of sinus issues and asthma issues just from the inhaled particles. The other thing that can trigger asthma and allergies during hurricane season is the obvious, the moisture and the humidity. Moisture and humidity really drives the growth of mold and dust mites. And so as many of you are trying to put your homes back together, you can see that you're having a lot of issues with mold and dust, and you're having to pull up carpets, and you're having to deal with branches and trees that have fallen. And that can really stir up a lot of issues if you're an asthma or allergy sufferer.
Well, just on a regular day here in South Louisiana, when you get a lot of rain just from summer thunderstorms, not a major storm like we've seen, you can get allergies and mold, but this really exacerbates it. I mean, this really brings it probably to the top of the charts.
This absolutely brings it to the top of the charts. So there's a thing called thunderstorm asthma that, it's a coined term that we know of that really means that, these symptoms get really flared when there's storms. And now we've just had a major hurricane where there's been a lot of destruction, as well as another tropical storm coming in. And so, we're not in the best situation when it comes to allergic health at the moment, but there's a lot that you can do to prepare and be on top of it so that you really don't have to suffer. And I think the number one thing to think about is just to be ready and prepared, not only for the storms that we're in right now, but also future storms.
Well, a lot of us get our hurricane preparation kit going, right? We have our flashlights or our batteries and maybe extra phone chargers, things like that. But you have to think on that side where after the storm passes, you have to be able to deal with that as well. You may get power back, but you're dealing with debris. You're dealing with maybe mold from, a roof leak. You're dealing with all these different things. So that's a whole nother layer after the storm that we need to prepare for that really a lot of us don't think about.
So I'd like to give some suggestions so that people can be better prepared. And so I think the number one thing for all general health is to have all of your medications ready. You should really try to have at least a 1 month supply on hand so that if you suddenly have to evacuate or you suddenly have a power outage or the pharmacies are closed, which is what we're dealing with right now, that you're not in a dire situation where you can't get the medications that you need. A lot of times, too, there's equipment that you use, like nebulizers and things like that for your asthma. If you can get battery-powered ones, so that in the future, if you suddenly have to evacuate or you are without power, you still have a way that you can treat your asthma symptoms. So I think, having that emergency bag and contacting your doctor before a big storm hits so that you can get extra refills is a really important plan to have in place, because I've had lots of patients who are displaced to different states, different cities, and they're struggling trying to get their medications, or when they return back to New Orleans, a lot of the pharmacies are closed right now, and what do you do in that situation? And so I think being prepared on the front end is really important.
Absolutely. And, when we talk about, prescriptions and make sure you have all that, you can now get 90-day prescriptions. So, that's something that you can get to really hold you over. I mean, hopefully you don't have to be away 90 days, but if it's a week or 2 or 3, that's just something else you don't have to worry about. We have enough going on, but to worry about medications that you need, that could be a major issue.
Exactly. And also a lot of services are paused right now. So things like your yard service, your mowing services, your garbage services, everything is sort of on hold. Well, when those things are on hold, it leads to the blooming of more pollen, more dirt, more dust, more mold. And so also kind of being aware when you are outdoors and you are a sufferer, you should really think about wearing your N95 mask, because that is going to really protect you from breathing and inhaling a lot of the irritants and the allergens that we're experiencing right now.
All right, Dr. Reena Mehta, thank you very much. A whole nother layer that we need to think about. And now with Nicholas bringing the rain, we've got more. Thanks again, and have a great day.